Yeah, we want to hit the spots. I always say that's the most important thing, but it is important to know your anatomy, what's joining onto what function it is, and things like that. But
we can simplify things, though, can't we? We simplify things all the time and just work the area of pain and get some movement in there. And g'day guys, Darcy Ninja here. We're here for part 2 of the top of the foot treatment. So Ninja just treated the top of my foot. I'm going to return the favour and now treat his peroneal, which is a muscle on the lateral part of his leg. So what's interesting about our peroneal, you can see this here, is its main action is to plantarflex, meaning as Ninja lies, it's pointing down. Okay, so our peroneal sits lateral just here. You can see that nicely in the sun. And as we dorsiflex, so the opposite to that this way, is our tibialis anterior. And our tibialis anterior lies right next to it. Where was our tibian? I think it was this way. Yeah, there it is there. So tibialis anterior, right along that tibia, that does the opposite. So what's interesting about that is they also come and branch into the top of the foot, right? All those muscles have a relationship. That tendinous tissue comes into the top of the foot, all the way into the big toe. We know how important it is to have good function in our big toe in terms of our balance and our proprioception and all of that. If we cut off your big toe, Ninja, you'd be stuffed, wouldn't you?
Yeah.
Like,
couldn't stand.
So these muscles come in and actually have a role and a responsibility of the movement of our big toe. Okay, so when we're thinking of our peroneal, so yeah, like that, Ninja, that's good. What I'm thinking of is, first of all, where does it attach and where are we going to start to treat from? So there's a nice bony landmark there. We're going to come off that and just use our thumb to sort of push back into that tendinous tissue, and then relieve some of the tension and pain that you might be feeling on the outside of the foot, but also affecting the function of the foot up here. So I just like to pin that without moving too much. Ninja's got a nice amount of wax on his leg just to, I don't know, get his leg looking glossy and tanned. So I don't actually need to add anything to that. We could do a broad palm and a pisiform through there just to feel for some interferences in the fascia or some things going on. Ninja's actually got a little bit of a lump in there. I wonder what that is. If it's just...
It's been there for ages. It's like a bit of fatty tissue, or I don't know what
it is. An old corky or something. You guys might be able to see that.
Yeah.
Might have just knocked his foot on something, or...
It's a little... Is it? They call them bursas or no?
Non-benign cysts. Sometimes you find them. Just a fluid-filled sac of fat, but it's... Anyway, let's stay on topic. Doesn't worry me. There's no pain. So we've also got a lot of nerves that run through the outside of our leg here. So we want to make sure that we're not going to damage those, but we're just going to also open up new avenues and channels for those nerves to sit, so they can help with the function of our foot as well. So peroneal, just next to our tibialis anterior. It's a different relationship. We were talking off camera about agonist and antagonist muscles, one muscle that supports the other through their action, so through their motion of movement. So an agonist, for example, our bicep is our agonist and our tricep is our antagonist. And you'll find that on the back of the leg, we find our hamstring and our calf, the agonist to our antagonist, whereas these guys lie right next to each other and yet do complete opposite movements. So making sure that these guys, what's important about bodywork here is that we're making sure there isn't this like mold or this cementation that happens between the tissues. They become cemented to one another when muscles come really tight, and the space that they're meant to sit in, that nice little groove that our body has perfectly designed, that groove that those muscles are meant to sit in becomes compromised from the muscles becoming so tight, inflamed, aggravated. So when this happens, we need to actually treat that area to soften the tissue, calm it down a little bit, and actually, therefore, you're going to gain your function back just by creating more space, more room for that muscle to sit. So yeah, we want to make sure that each muscle has its role and its responsibility. Everything in our body has a function, and we want to make sure that they're doing. The possibility of doing that isn't interfered with by muscle tension and tightness. So organically, I just started to feel that my direction of my stroke started to work down the tissue, and I reckon it's just the angle that I'm on. I'm going to trace that all the way down until I've gone over that little spot there. How's it feeling, Ninj?
Yeah, good. All the way through.
Yeah.
Kind of, yeah.
Just being thorough with it, making sure we are getting the whole area. And as we get down here, the layers get more superficial. So up here, nice and strong and fatty. Down here, it doesn't need as much pressure, and because you can feel that's going to be more painful. You can already feel that, like, I'm working more onto the bone there. Actually, starting to file away some of the scar tissue I can feel on that little outside of the bone from all the years of Ninja living his best life.
Yeah.
And coming into the top of the ankle here, that lateral malleoli.
You know tertius, Darcy?
Tertius, yes. Tertius is a dorsiflexor, and it's through here, is it, Ninja?
Yeah, I just know that it goes over that way, and the other peroneals go around the back of the ankle like a pulley.
Yep.
I love that.
So that's what's cool is we've got it that comes all the way around here, doesn't it? And helps. That's why plantar flexors pulls down, doesn't it?
Is there any that go into the bottom of the foot? You remember with the peroneal?
I'm not sure if the peroneal goes into the bottom of the foot, but something does.
The tertius goes into the side of the foot there.
Yep, tertius comes into here.
Yeah.
Yeah, it's just fascinating how many layers there are to, like, we're always learning and rediscovering things and looking back at things and going, oh wow, how many layers, or the concepts of that, how that moves and the relationship to that muscle. Body's fascinating and we love it. And we're always learning new things or going back and rediscovering stuff. So that's why these videos are great, not only for you guys to learn something, but also for us to, I just really want to embody, what we do, and learning that sort of stuff and being competent in so many areas, I think makes us, grow, be the best body workers we can be.
Yeah.
Oh.
Yeah, we want to hit the spots. I always say that's the most important thing, but it is important to know your anatomy, what's joining onto what function it is and things like that. But
we can simplify things though, can't we? We simplify things all the time and just work the area of pain and get some movement in there, and that's easy. But yes, it's also fascinating to check it out and dive deeper and look at how the body is designed.
Ultimately, it's about getting people out of pain, isn't it? And functioning without being able to perform with their sports or just their life, really. So that's what we're trying to do. Is, get people out of pain.
Get people out of pain. Now, why it's important to do this is, I probably should have touched on it at the start of the video, is as we walk, we're constantly plantar flexing and we're dorsiflexing, right? So that motion of that movement in our ankle and our foot, that's repeatedly occurring, if that's interfered with because of the tightness in the outside of our leg, like our peroneal, we're going to be in pain, we're going to be in discomfort, we're not going to enjoy our sports or anything like that. So this is why we're showcasing how we treat it, what we do to unravel that tension and reinforce that movement.
That's good, bro.
Yeah. So that's all pisiform. It doesn't look like much, but outside of my palm in there, it's a nice little bone that I can use to gouge and hold and work up.
A lot of people would have been sore at certain stages in your life in these sort of regions too.
Yeah.
So we're sort of saying you can make it better. You can treat it.
Yeah.
It's not just these fleshy bits that's, for massage, for body work. It's the tendons, it's the joints, it's the nooks and the crannies. It's where it doesn't look like it's fleshy.
Yeah.
But there's.
Can use a bit of a knuckle maybe to just, like that's going to be a bit more tender, and then pull it away, get that separation. Probably getting a little bit of gastroc there.
Yeah.
And that's mostly just pressure. Pressure creates diamonds. Pressure creates good things in our body work. We want pressure to unravel the tension.
We want the opposite of diamond making, don't we?
Yeah, exactly.
We want flow.
We want blood flow.
Yeah. Things are stuck and they're hard and they're bound up. So we're trying to, remedy that.
Exactly.
Melt it down.
Whoa. So, we hope you guys enjoyed part 2, top of the foot treatment. If you haven't seen part 1, make sure you go and watch it. We are enjoying ourselves lying out in the sun. Look at Ninja, he's a bloody model, mate. He's a bloody model. He's fucking almost 75 years old. Look at him, he only looks 30.
I know. Going all right.
We're just teasing. If you can guess Ninja's age though, maybe we'll
buy a bag of lollies.
We'll send you some mushrooms if you can.
Mushrooms, yeah. We're going to give you lollies. Mushrooms. They're poison.
Yeah. Comment below Ninja's real age, and if anybody knows his birthday, put it in the comments. When do you think it is? Close.
First comment.
Yeah.
That gets it.
We'll know if anybody's watched the end of our video if we get any comments related to this question. Yeah. So that's the trick of the. Maybe we'll get Ritesh.
Ritesh.
Anyway, guys, thanks for watching. Make sure you do like, subscribe. We really do appreciate it. We'll see you guys next time.
Done.